A lot of young adults are aging out. They can no longer be on their parents' healthcare program. There's stress and employer healthcare. Some of them are seeing hundreds of dollars a month they're going to have to give up. Understand there's better ways. I've talked about it numerous times on this platform. There's programs where you can just video conference a doctor starting at $50, get a diagnostic, get a prescription, and you're done. You did it, you paid once. If you had to do that 2 or 3 times a year, it's $150 to $200. Understand that we all carry a PH level doctor in our hand. If you have ChatGPT, Gronk, or any other AI system, example, pink eye, take a picture. Hey, what is this? It'll tell you. Your throat hurts. Take a picture. Ask the AI. It'll tell you. It'll say, I'm not a doctor and you should probably see one, but it'll also say, in the example that I'll use, my daughter got food poisoning, violently threw up, and then her throat got really irritated. Thought she may have gotten bronchitis or tonsillitis or something. Fed the picture in. It looked, there was no pus, it was irritation. It said, it's probably just irritation from the food poisoning. You just got to give it all the information and it'll shoot it back. We all carry a PhD level doctor in our hand if we have a cell phone and we have an AI system that's downloaded. This works for young adults, it works for families. Um, you can feed all the information. My kid has 102 fever, this, and that, this, and that. It'll even know what's being spread out there and it'll come back and tell you this is what you should do. In my opinion, it's a blessing for young adults to understand right from the beginning there's so many other options. It doesn't have to be the health care that your employer provides. And then you grow your family out, and that program just gets more and more expensive. People are reporting they're paying up to $2,500 a month for health care for next year. That's like $30,000 out of your income that you're going to pay just in healthcare. Yeah, if everybody just decided to opt out, and a lot of people are because we're seeing hundreds and thousands of videos of people opting out, guess what would have to happen? Yeah, you vote with your dollars. You just say no, and you turn around and you walk in the other direction, and then you'll find out that there's solutions that are way cheaper. Why not just pay when you're sick? You can video conference a doctor if you have to talk to somebody. You can physically just get on the phone, talk to somebody, give them your symptoms. They'll take a look at you and they'll write you a prescription. Yeah, I understand that that doesn't cover you if you have a major accident or you need a surgery, but there's insurances for that kind of stuff that are much cheaper, much cheaper. That if something like that should happen, you're covered if you have that insurance. But to pay $30,000 for a family, if you're making 100 grand, now you're only bringing home 70 grand, and then you got taxes. You see what I'm saying? You're going to be 50% of your income in taxes and healthcare, and you're keeping 50 cents out of every dollar.